this was my identity.
Nobody talks about how freaking hard it is to be a dentist. What most people talk about is how this affects the patient. What nobody talks about is how this affects us. Dentistry is ready for this. Now is really the time.
Welcome to Wellness and Dentistry. I'm one of your co-hosts, Dr. Martin Mendelson. I'm a disabled dentist, coach, speaker, thought leader, and author. And I'm joined by my very good friend and co-host, Dr. Kyle Stanley, also a dentist, tech entrepreneur, speaker, and researcher. And together, we've helped thousands of dental professionals pursue wellness and dentistry. And if you're unfamiliar with us, we invite you to check out our respective links, websites, and course offerings that are all linked in the wellnessanddentistry.com website. And if you like what you see, come hang out with us this coming May 9th and 10th in Irvine, California at Glidewell Laboratory, where we have our live 2-day in-person course called Lightside Live, 12 CEUs, lots of fun. You get to know us and the other course participants, and it's one of the most transformative things we do all year to help our colleagues find wellness in dentistry. And today, we're going to be discussing something very near and dear to both of our hearts. We're going to be talking about the enduring dentist. What does that mean? The enduring dentist, movement, mobility, and longevity in our profession. So, Kyle, hello to you, first of all.
Hello to you. I love this word enduring because it shows just how hard dentistry is, right?
Yes.
I mean, no one understands a dentist like another dentist. And we can talk openly here, but if you say this at a dinner party or if you say this to someone else, someone goes, "What do you mean? You just sit here and," for those of you that can't see, I'm just kind of doing little tiny movements with my hands, right?
Yeah.
That's what people think we do. And although that's what we do physically, there's such a physical and mental demand on us that it is enduring.
Absolutely.
As much as we love doing the clinical work, if you want to do this for 10, 20, 46 years like my dad did, you have to figure out how to be sustainable with this. And I think Martin has a great example with his disability that you have to be, not that your disability had anything to do with your physical shape, but in order to do this long term and do it to where you don't have chronic pain every single day that can really affect your mental wellness, you have to make this a priority.
Absolutely. It's ironic. I forgot to tell you this, but last night, no joke, I saw this reel by this dentist. I think he was out like 10 years, and the whole reel was about when he was getting out of dental school. He used to think, his words, that dentists that only work 3 or 4 days a week were, quote, lazy. And the whole reel was talking about how wrong he was. And that once he got into practice, he realized how mentally and physically demanding this is, that 99% of us are really, really hard workers. And that it takes such a toll on our bodies physically and mentally. And so it's something we really need to think about relative to the long term. Like, what is the price that I'm paying to work 5-6 days a week? Now, granted, let's talk reality here. For many of us first starting out, that may be necessary. While at the same time, we're talking more long-term strategies. And so, like anything in life with any goal, if you say to yourself, okay, I'm going to work 5 or hopefully not 6 days a week, I'm going to do this for 2 years and then reevaluate. That's a lot easier of a thing and pill to swallow than if we just make this the assumptive way we're going to live our lives, right? Because we're going to pay a price otherwise.
Well, and it's very easy to continue that if you don't have an end goal.
Correct.
I know friends who are 15 years out of school that are still working Saturdays, not because they have to, because that's just what they've always done.
Yes.
And sometimes I want to kind of shake them a little bit and say, you don't need to do this.
Yeah, absolutely.
Now, maybe they could work Saturdays, but take Friday off then, or take Wednesday off. And it's funny how you're right. You talked about that reel that you saw. We get chastised a lot by other medical doctors So for example, I had a post on one of the other podcasts that I host,
Hmm.
and I said something like dentistry is so effing hard and nobody understands it unless you're a dentist, right? And it went kind of viral because every other medical practice chimed in saying, "Oh, I wish I could work 4 days a week. Like,
Yeah,
I wish I didn't have to do life-saving treatments." And we can all go back and forth and say, my job's harder, your job's harder. That's not what it was about.
yeah,
But the fact that so many of us take at least a day off, like let's say a weekday off, it's so
yeah.
normal that dentists don't work 5 days a week, just shows you how hard it is.
Absolutely. And I think the other thing I'll say, and please, everybody, don't misunderstand me. I am not sitting here comparing. I'm simply, shall we say, adding up hours. And what I mean by that is, and again, I'm, I don't want to be accused of comparing. Even with surgeons that are in the OR for, 5, 10 hours at a time, they're still not doing it every day of the week. And so, how many days a week are they in those positions? And we can put people that are anesthetized in an OR situation in every which position way to Sunday. And so, there is no way around that a 5, 10, 12 hour surgery is horrific on your body, period. I think what we're talking about here is the toll that occurs over years of doing this on a daily or almost daily basis. I think that's the deciding or differentiating factor between dentistry and other medical professions in many ways.
Well, I'd like to tell a little bit of my story with
Mhm.
my physical story, let's say,
Yeah.
is that, even 1 year out of residency, I already had debilitating back pain.
Yeah.
1 year.
Yeah.
And I use loops. I use my mirror when I can. I mean, one of the challenging things for me was because I did a lot of surgery.
Hmm.
It's more challenging to use a mirror for
Yeah.
like when you're doing extraction, for example,
Totally.
right?
Totally.
It's because you're putting so much force and you kind of need your other hand to maybe even use as the fulcrum. So I was working for DSOs. I was working long hours. I was working 6 days a week, of course. And yeah, 1 year out of school, I was already having this back pain, lower
Yeah.
back pain. And it was about really when I was in probably my darkest stage when the back pain got really bad.
Hmm.
And then it moved into sciatica. So for those of
Hmm.
you that don't know sciatica, it's a nerve that runs basically all the way down your body, down to your feet. And I still, even just this week, I was telling my wife that, when I stand or when I sit or I make that transition, like I was sitting on the ground with my kids and I got up and went like, oof. And my
Yeah.
mother-in-law who's here said, oh, are you having back pain right now? I said, yeah, I kind of always do because of my years of dentistry.
Yeah.
And you don't realize how hard it is, and you push through it so much because you just want to get that final margin. You just want to make sure that implant goes down perfect. I'm going to turn myself completely upside down just to get this done. And some of that goes back to not putting ourselves first and our identity as a dentist. It's like, well, I'm going to get this done because I do good work. That's what I do.
Yeah.
And I'm willing to sacrifice myself to make sure this works. And that can work on an individual patient, but that can't be something that lasts your whole career.
Yeah. I was thinking as you were talking too, it can be for some procedurally based as well. And so we have to take a step back and really think about the cost. I'm going to be using that term a lot this weekend or this weekend, listen to me, this recording. Um,
Like you're giving a weekend CE
like
right
I'm
now.
getting, yeah, I know.
Yeah.
Like
Hey,
I
you're
don't
getting a
know.
lot of value for this. It's like a
I think
free
it's
weekend CE for everybody listening.
yeah, I think it's a Tuesday on the day we're recording, I think. Um, but look, you hit the nail on your head about doing it every day. And so if there are specific procedures that really set your back off, we need to ask ourselves, is it worth accomplishing those procedures? And again, you may look at me and say, well, it's easy for you to say, yeah, because I've been to hell and back. And I have a different perspective, having seen that my life didn't come to an end. I can tell you there were many days or shall I say mornings and evenings as I was going to bed when I cried myself to sleep or got up in a panic, not knowing what the next day was going to bring. While at the same time, I would look any colleague in the face with love and say, if endo really bothers your back or extractions or what have you, then why are we doing it? Because if it continues to escalate, then you may be in a position like me where none of it is possible. So which would you choose? Right?
Yeah, and real quickly for anybody who's a new listener, Martin's hand stopped working for, I can't think of a better
Yeah.
way of explaining it,
Yeah.
and he had to quit clinical dentistry.
Yeah. And I was out of
So,
work for over a year.
yeah, so this is coming from someone who is disabled from clinical dentistry, and I think that it means a lot coming from you. Is like, what's the cost?
Yeah.
And I think we need to think about the mental cost that
Yeah.
comes along with chronic pain too, was something that I didn't realize. It was like I had chronic pain and that was just part of the job. And every
Mhm.
day before or after, I kind of am moving around and, touching my back and asking my wife to give me a massage or, trying to stretch or, oh gosh, whatever I can do.
Mhm.
But there's a lot of research showing the mental cost of chronic pain and how this can reduce the the depth of your relationships, how it
Oh
can
yeah.
cause you to go into depression, how, I mean, let's even think about it purely financial. Your
Yeah.
case acceptance won't be as high. You won't be as good of a leader.
Yeah.
Like that is all real stuff.
It is all real stuff. And I've been there and bought the t-shirt and it it literally rewires your brain. And I have a story about that. It's a subjective one, but a story nonetheless. In my darkest days, so we're talking about 5 to 7 years, which is a decent pretty long time. Uh, I always had, narcotics in the house. Thank goodness I was not addicted to those substances. I didn't have an addictive personality to narcotics. Alcohol's another story. And I would only take them when things got really, really bad. On average, I would say once a month, once every 6 weeks max. But here's why I'm telling this to you. Do you know that I got so rewired that Martin Mendelson lives in a state of chronic pain? When I would get a simple headache or a simple body ache, I would have to be reminded, oh, did you take a Tylenol or an Advil? Because it literally didn't occur to me that I could take something to help. How crazy is that?
Wow. Yeah.
And
Yeah,
and I
because you're always in pain.
And I say that in all candor. I'm not even joking. Like it was literally like, oh yeah, I can take Advil for a headache. Like,
Right.
really? Yeah.
I think one thing that I did poorly. And by the way, let me just preface this with now we're in the beginning of this episode, we're talking about a lot of the problems that come with it, and later we're going to talk more about solutions. Okay, so now we're
Mhm.
talking about problems,
Yep.
avoidance,
Yep.
and then we'll talk about solutions more at the end. One thing that I did incorrectly was take on patients
Mm.
that couldn't get in the proper positioning.
Yeah.
So we all have those patients, right? They're in their 70s, they're in their 80s. I can't go back any further, right? Which, maybe they really can't.
Yeah.
However, do you need to treat them then? And before Martin answers, I would ask you to separate your identity from this answer.
Mm.
Separate your caring, heart-centered feelings from this
Mm.
answer. And maybe even be a little selfish. Because, yeah, you may have that old gentleman or that old lady, and she's so sweet. He's so sweet. They pay on time. They show up early. They're so nice to your team members. I mean, they're just amazing people. But you've got to do 3 inlays and a
Yeah.
crown and a root canal on this patient, and they can only go back 15 degrees.
Yeah.
And it's, by the way, it's all on the maxilla. And
Hmm.
so what are you willing to endure? How much are you willing to be beat up to help this person. And I'm going to say that for me, the hardest part was that I wanted to help these people.
Yeah.
And so, me being a caring, virtuous person during that time was to my detriment.
Yeah. What I'll say a couple things. First thing, I have a story from when I was young in practice that I've never forgotten. It was an older gentleman who said he couldn't go back. Maybe I got the chair back 40 degrees, not even 45.
Hmm.
And I thought I was being so smug. I'm embarrassed to tell you this, so I can tell you anyway. And I said, I felt like, oh, I'm gonna get him. I was like, well, you sleep lying down, don't you? And he looked at me and goes, no, I sleep in an armchair. I
Oh,
was like,
wow.
"Oops." So when you were sharing the question you wanted me to answer, it threw me back to something I mentioned in other episodes called the mom principle that I followed, which was if it was good enough for my mom, it was good enough for my patients. If it wasn't, it wasn't. And so I'm doing a morph of this relative to, if I didn't feel like I could treat my mother adequately given these parameters, would I do it? And the answer would be no. So that's selfish and selfless all at the same time. And I think, to talk about solutions to this, just bumping ahead a little bit, it's all about filtering, right? Because that's got to be if you're in a situation where you have a physical impairment or an impending physical impairment, that you would be in a decent pain situation because of needing to treat at a less than ideal place, then we need to start filtering so that you can identify these people so that you're not putting your own body at risk to treat one patient to the detriment of 20 to 200.
That's a great way of thinking about it. Yeah, even from just, I love how you said that because, like, if you came to a dentist, let's say I'm about to work on that patient, they can't
Mm-hmm.
go back, and you came and said, "Excuse me, Dr. Stanley, you like to help people, right?" And I said, "Yes, of course. I'd love to help as many people as I can."
Yeah.
Okay, if you can help this one gentleman, or you can help these 90 people,
Yeah. Yeah.
what would you rather do? And it's really great how you put that because
Yeah.
I think so many times, what is that? Penny wise,
Pound foolish.
pound foolish,
Yeah.
right? Is
Yeah.
it's kind of the same thing, is that early in our careers, or maybe not even early, we may think, I just really want to help this patient no matter what it takes.
Hmm.
But what is the cost on the end? And will it allow you to not, or will it hinder you
Yeah.
from helping hundreds of patients
Yeah.
through the rest of your career?
And couldn't you theoretically extrapolate that? Because I love how you couched what I said. You could even extrapolate it and said, you can practice for 5 years and help this number of people, or you can practice for 25 years and help that number of people. It is literally the same comparison, if you will, because what we're talking about is agreeing to a physical and mental cost to the detriment of your future ability to provide care and to make a living for yourselves and your family and your loved ones. That is what we're talking about here.
Yeah. And I'm thinking back, I'm kind of trying to go back into myself when I'm getting closer to my deepest point. And I was doing a lot of surgery then. I was having a lot of back pain.
Hmm.
And I was doing anything to get that last little root tip out, to place that implant perfectly, to get that impression, to finish that margin, to take that. And I think the hard part for me was, what's funny is I was making good money.
Hmm.
But if you asked me then, it was like, no, I need to make more money.
Yeah. Well, it's all relative. I
Yeah,
mean, what are those studies? I mean, granted, these studies are of the general populace that don't necessarily have $500,000 in loans.
right.
But there's been a bit of research on what's the line over above that it doesn't make that much of a difference, and it always seemed to be a little bit low. I think it was like 70,000 or something. But the point is that I'll use myself as an example. I've had many times in my life where there's been a pretty significant swing in my annual income. And I have to tell you, I can't think of a time where I really felt like I was wanting for things. Now, does that mean I didn't have times in my life where we scaled back expenses, we didn't go on vacations, we had to do X for Y or Z for PDQ? Yeah. While at the same time, that wasn't what was driving my life satisfaction. It was, being with my husband, it was being with my family, my friends, doing things that I enjoyed. And there's many things I enjoy. There's many things that everyone enjoys. Some of them cost money, some of them are free, and so we just need to be careful of that. Like, do we need to make that much money? Yes or no?
I mean, one of my happiest times was when I was making probably the least amount of money that I made in my career.
Yep.
It was, and it was because I scaled down my clinical,
Hmm.
and finally my back didn't hurt anymore, and I had time to go to the
Yeah.
gym, and I had more time to be with my family, and I was making less money, and I was so happy.
Yeah.
It's funny how that works out, right?
It's true. It's true. And, until you've been in that position, for anyone who's, doubting us right now, until you've been in that position, it is a little hard to imagine. And I
Yeah.
wanna I wanna see you, respect and honor you all right now, because it is a very difficult thing to see until you've been through it. Many of us in all walks of life that have been through it, it wasn't by choice. And so, but what's cool about that, and what's so blessed about that, is that it does give you the perspective. And
Hmm.
so it is true, paraphrasing something Viktor Frankl said, there's always hope in the darkness. And so, you know, the what is the cure for darkness? It's bringing light into the equation. So how can we shed light on this darkness? How can we look at things differently, do things differently? Because it is a matter, it is also very significantly a matter of perspective.
So let's bring this first part kind of into land, and then we'll transition into the next
Yep.
part of this discussion. I would say this first part of this discussion is yes, dentistry is challenging. It
Hmm.
is physically challenging, it is emotionally challenging, and when it's physically challenging, it becomes more emotionally challenging.
Amen.
So let's do everything we can, such as loops, microscope, indirect vision, patient positioning,
Hmm.
ergonomic chairs, all of this stuff. Let's do all of that because all of that is an investment into your future.
Absolutely. And so I'll go one further. Numbers don't lie. So, unless you've only been out of school a year or two, take a look at your data. Take a look at what you've done over the course of the year. What procedures were those? What was the most profitable per hour? And then look at that in contrast to not only what you like to do, but that's also less physically taxing. When you start to look at those numbers, that might give you, not might, it will give you a whole heck of a lot of things to think about, because something we've talked about before is I'm going to say it this way on purpose, foolhardiness of us thinking we need to include endo or implant placement or third molar extractions for the production. But then when we actually look at cost and time, we realize for some that it's a much less productive per hour procedure. So why the heck are we doing it? So all of those things are important, with the added caveat that we need to make data-driven decisions based on the reality of what we're producing every day, week, month, and year.
Yeah, I love that. And adding onto data, let's look at some of the data of how many dental professionals have musculoskeletal pain. I
Yep.
mean, one research article that I like to quote is 87 to 90% of practicing dentists have musculoskeletal pain.
It's insane.
90%.
Yeah.
And I've done this before. We do this in our Light Side Live. Raise your hand if you have neck, back, elbow, wrist, any of this. At
Yep.
least 80, 90%, if not every single dentist in the room is raising their hand.
Mhm.
because it's so physically demanding. We work through a Cheerio every day. We're doing Greco-Roman wrestling with the tongue. We're in the dirtiest part of the body, or maybe the second dirtiest part of the body. I mean, dynamic. We're in the airway. They have to eat, kiss, swallow, drink, talk, breathe, all in the same area. It
Hmm.
is so physically demanding what we do. Even when you look at dental students, there's a
Hmm.
study from the British Dental Medical Journal. 70% of third year dental students already have musculoskeletal pain.
Yeah.
And that is challenging. Entering your profession that you're so excited about, right? I finally did it. I got through dental school. I'm ready. And you already have chronic pain. I mean, the mental and emotional cost of that to do that now, you're going to do that for 40 years,
Yeah.
is
100%.
so
It's,
difficult.
and even to state the obvious about presence, right? Even if you're a master at shifting your mindset to be as present as you can with your patients while at the practice or your family while you're at home, you're not going to be able to do that as effectively, if at all, if every time you move, your back hurts or your neck hurts, etc. So, yeah.
Such a great point, and I experienced that.
Hmm.
I fully experienced that. And so let's talk about this idea of really what today is about, which is mobility, flexibility, strength, exercise. And I think for me, this really comes with treating yourself like a high level athlete. And
Hmm.
so I posted some stuff recently that got a little bit of people thinking about this. And that's really this. Let's think about your favorite athlete. Whether, we have Europeans listening and they're say and it's an F1 driver, or, if it's hockey like me, or if it's basketball, LeBron James, or if any of these high level athletes, any athlete you can think of. How long do they have to perform at a high level per day? Okay. I would say it's probably 2 to 3 hours,
Hmm.
right? Even if they had, we can talk about basketball, even if they had an NBA game every single day, how long is the game? 2 hours, right?
Hmm.
Maybe three if you talk about beforehand and training and afterwards, 3 hours a day. We dentists perform at a high level where we're measuring in microns for 8 to 10 hours a day.
Amen.
Now, when you look at the training that a professional athlete goes through, and you look at the training, and I'm talking about physical training, that we dentists go through, these are nowhere close.
Yep.
We are performing at a high level 3 times the amount,
Hmm.
but we're exercising, taking care of our bodies, eating right, a tenth of the amount, maybe. And once I started to make that distinction, gosh, it really changed my mind about what I did. I was like, well, I'm a doctor, and I perform surgeries and I treat patients, whatever. But I'm not like a professional athlete, like, come on. But to hold yourself in that position and do these micro little movements is really physically taxing for him.
And how many of us make it even worse? How many times have we all heard, "Oh, I don't have time to go to the bathroom. Oh, I don't have time to take a lunch." And I will lovingly and argue with anybody with a smile on my face until my last breath that that is a choice that you have made.
So true. It's so true, right? So one little thing, like, well, you don't have time to take a lunch. Why not? Oh, well, because my team scheduled an emergency patient at lunch.
Yep.
That's because you allowed them to.
Correct.
If you had set that expectation and if you had
Mhm.
communicated, listen, I worked on 5 patients this morning. I have another 4 patients this afternoon. My lunch is precious. I need this
Hmm.
time to rest and recover and eat and go to the restroom and drink water. Do not schedule a patient. I don't care if it's big production. I don't care anything,
Hmm.
right? You need to recover just as much as that as your patient may need to, right? Because your patient is saying, well, I only have my lunch break available because I'm working. And what your team should say is, well, that's when our doctor has to eat too. He or
Yeah.
she has to eat as well. He or she is also a human.
Yeah. And we fool ourselves into thinking this is how it has to be done. So, I'm not exactly a spring chicken, and so there's certain procedures that people have to get when they get to my age. And he only does them on, I think it was Tuesdays and Wednesdays. What am I going to do? Go, oh no, I'm sorry. I'd rather have this procedure on a Friday because I can't eat for 48 hours and then I'm going to be loopy from the anesthetic. No, that's not the way it works.
Yeah. And let's talk about to the association. We've talked about it a little bit before between, pain and mental health. But let's talk about the opposite. Let's talk about physical activity and mental health.
Yeah.
Because even if you came into this and said, listen, I don't have time to exercise, I just want to feel better, right? I don't care if I have six-pack abs or big muscles or, I fit into my bikini or whatever. I just want to feel better. Like I'm just burnt out with this.
Yeah.
Do you know that one of the largest studies, the Lancet Psychiatry study in 2018, looked at 1.2 million patients? People that exercised for 30 to 60 minutes, 3 to 5 times per week, had 43% fewer poor mental health days per month.
Yep.
43%
Yep.
fewer poor mental health days per month.
Mhm.
So even if you're not doing it from a physical standpoint, you're doing it for a mental standpoint, this
Mhm.
can be an absolutely huge change.
Well, and I believe, the other thing we have to understand too is the power of compound time. So if you don't have 30 minutes, you might have 15 and 15 in a
That's
given
true.
day, right?
Hmm.
Like I was thinking about this the other day. So I have a dog who's, my furry child, and we go on a walk every morning. And out of curiosity, I looked, this is recently, I looked to see how long it takes me to do it on average. And it was anywhere between 9 to 13 minutes,
Hmm.
which isn't that long. Let's make that 10. Well, if I have morning duty every morning, which I do, what's 10 times 70? Or 10 times 7 is
Seven. Yeah.
70. So I'm walking over an hour a week in 10-minute chunks,
So true.
right?
So true. And when you look at the low end of this study, 30 minutes per day,
Mm-hmm.
3 times a week.
Mm-hmm.
That is not that much time.
No.
Every dentist that's listening to this is definitely spending that on Instagram.
Yep.
It's definitely scrolling through something else. It becomes a priority. If you make it a priority, it becomes fairly simple to do this, right? It's like it's simple, not easy, as
Yeah.
those people
One of my
say.
favorite phrases.
Yeah.
But and let's give this a little even deeper level of respect relative to individuality. Because I encounter this with my coaching clients all the time. Not everybody is the same. And there's morning people, there's night owls, and there's everything in between. So if you're really committed to doing this, to bringing physical health into your life, and you say to me, Martin, when I get home at the end of the day, there's just no way I can do it. I'm spent. My answer to you will be, great. Okay. Then when else can we do it? Because you were just talking about 3 days a week. So theoretically, that could be Saturday, Sunday, and Wednesday. So theoretically, there's one day of the week that you would need to commit to physical activity during the time in which you're also practicing. So there's multiple different ways to skin a cat. And so sometimes we get so caught up in, I don't have the time, that we don't have enough of an open aperture to think about all of the options that are available to us.
And it has to become priority. You have a friend that you've talked about on the podcast before that goes to the gym. He's an
Yeah,
oral
Jay
surgeon,
Platt.
right?
Yeah, yeah, yeah.
And he goes to the gym for what, 90 minutes every
90
day in
minutes
the middle of the day.
every single day. And, I'm not going to say how old Jay is. I know how old Jay is, but Jay's older than I am. And he says point blank, because I've heard him say this in lectures as well. If I want to keep doing this, I need to stay physically healthy. He's an oral surgeon. He's been doing this for many, many years.
Yeah.
And he recognized years ago that if he didn't treat his body with respect, his body ain't going to treat him with respect.
And let's talk about to the minimum, right? Let's say you have 1 hour per week.
Hmm.
I can do 1 hour a week, right? To start. It's a great way to start.
Yeah.
In a study with 30,000 individuals, exercising 1 hour per week was enough to see lasting decrease in depression symptoms.
Yeah.
So I've said this before when people come up to me after I'm speaking live, many times people will come up to me and confide in me and say, Kyle, I'm really burnt out right now. Like
Yeah.
I'm pretty low. My first two questions are, how is your sleep?
Yep.
And do you exercise?
Hmm.
Because it's very easy to make changes. And there's a gigantic change that can happen. And so recently I saw something, I just added this yesterday to my lecture. I haven't even told you about this, Martin. Something called hope molecules. Have you heard about this?
No, I saw you put it in the show notes and I was like, what is that? But yeah.
Yes, yes, yes. Okay. So I just learned this yesterday. I looked at
Yeah.
all the research. Super cool. Okay, so I'm going to read you some stuff. Hope molecules is a term used to describe myokines, proteins released by muscles during physical activity. So you're contracting your muscles, these proteins are released.
Hmm.
These molecules have been found to act as natural antidepressants, enhancing mood and mental well-being. When muscles contract during exercise, they secrete these myokines into the bloodstream, which can cross the blood-brain barrier and positively influence brain function. One
Hmm.
notable myokine is brain-derived neurotrophic factor BN or BDNF, which supports the growth and development of new neurons in the brain, thereby enhancing cognitive functions like learning and memory. Regular
Mm.
physical activity increases this myokine, promoting neuroplasticity, the brain's ability to adapt and reorganize neural pathways. Now, that's super important when we
Hmm.
talk about optimism, growth
Yeah.
mindset,
Yeah.
right?
Yeah. Well, that goes even back to Barbara Fredrickson's broaden and build theory, which is similar but different, meaning, she showed that those individuals that are primed in a positive state see things differently, are open to opportunities, are open to other variables, etc. And that by doing so, you actually reestablish new neural highways, so that when you're challenged again, you can go back through positivity, etc. The way I describe this to people is something that I know we've all universally experienced, which is this. You're in a challenging situation, you're negatively primed, you're angry, you're upset, you come out of it, and when you're calm, you say, why didn't I think of that? Why didn't I say that? Why didn't that
Yeah,
occur to me?
right.
There you go. So it's interesting too, because as you're reading the study, my interpretation of this is that it's almost as if it's a chemical proof of what they had seen almost subjectively for years relative to exercise, regular exercise, improving mental health, right? So
Yeah.
now they're actually putting a name to a chemical that is created when we are contracting our muscles. So it's kind of interesting.
And
So,
it's funny how, people that are light-siders that have taken my course or our live course know
hmm.
my acronym of DREAMS, which is
Hmm.
diet, relationships, exercise, appreciation, meditation, and sleep. These are the things that I think we should do outside of the practice that really help us show up inside of the practice to be the best people we can be.
Hmm.
And the more I talk about these since 2018, the more I realize how intertwined they are. So I
Hmm.
used to kind of think, okay, diet is over here, relationships over here, exercise over here, appreciation over here, meditation over here, sleep over here. But now you get things to where if you are exercising and that may allow you to show up better and have better relationships.
Hmm.
Or like little stuff like this. I'm reading one of the studies that I talk about in Lightside. After 4 weeks of weight training, participants had greater positive well-being and personal accomplishment.
Hmm.
Resistance training was noticeably effective in increasing well-being and personal accomplishment and to reduce perceived stress. Now, going back to that acronym, one of the reasons to increase your sleep is to decrease your stress. So it's
Hmm.
like this same thing, right? You do the exercise may increase your relationships. You do the exercise, that may make your sleep better. When you
Yeah.
sleep better, you're more recovered, you're not as reactive. Or also, too, when you sleep better, you're less likely to overeat. That goes back to
Yeah.
your diet, right? So it's
Yeah.
like it's all connected here. Look at this one. Results showed that the intervention group significantly reduced emotional exhaustion, depersonalization, and perceived stress, and increased personal accomplishment. Now, when you look at reduced emotional exhaustion, depersonalization, and perceived stress, those are two of the three definitions that make up burnout.
Yeah.
I mean, almost exercising alone could be such a significant change for combating burnout. And I've seen it in myself and in
Hmm.
hundreds of doctors that I've helped.
Well, and I was just thinking about my own personal journey and my own personal experiences. Recently I decided to kind of hire what I'll call a virtual trainer. He's actually local, but he programs my workouts based on the equipment I have at my house. I don't have a full gym at the house, but I have, some decent equipment. And what I've noticed is that it's a lot easier for me to stick to a healthier eating regime, or shall I say more balanced? How about that?
Hmm.
Eating regime when I'm actually in the process of being active in my physical fitness. And you could argue that, that's a mental game, right? Because I'm choosing to not snack or pick a
Yeah.
different snack, etc. And I can tell you, and again, this is my subjective personal experience, it all goes back to feeling good, feeling good about what I'm doing for my body, and then therefore wanting to support what I'm doing for my body and not be of detriment by my eating habits.
Yeah.
Now, my eating bad is most people's good. I know that sounds very bizarre, but if you've never met me, I'm kind of a short guy. I'm 5'4". And when I was 18 years of age, I had a 42 waist size.
Wow.
So I lost like 30 pounds when I was in my early 20s, and I've kept it off ever since into my 50s. So I know how to eat on a regular basis to keep myself within certain limits. However, having gone through the pandemic and breaking my sternum, that's a whole nother story. I've gained some weight. And so now I'm in a process of losing it. And I've been observing this, being in a different place and having more knowledge today, how the physical activity not only affects my mental mood, but my processes and then subsequent actions based on mood and presence and I'll call it happiness or contentment. It's wild.
Yeah. So I think that if dental professionals can think about exercise as a part of your profession,
Yeah.
like this is what you have to do to maintain it. Just like
Yeah.
how, Kobe Bryant would shoot 100 free throws in a row until
Hmm.
he made it before he left, right? It was like that was part of his training
Hmm.
for his profession. That's how we should think about ourselves. And in addition, don't only think about exercise as looking good in a bathing suit.
Oh yeah.
That should be the result. Or sorry, that should be the side effect.
Oh,
It's like how,
100%.
a lot of people say good the aesthetic should be the side effect of doing good
Hmm.
dentistry.
Yeah.
It's the same way. It's like
Yeah.
aesthetics of your body should be the side effect of feeling better and preparing yourself for your profession.
Yeah. I don't think I know. If you read James Clear's Atomic Habits book, he calls them lagging indicators, right?
Ah, I
So
like that. Yeah.
your biceps would be a lagging indicator of your fitness habits. Your net
Yes.
worth is a lagging indicator of your financial habits.
Yeah.
It's And he even talks about, and we've talked about this in other episodes, so I won't go into it too much here, the idea of identity-based habits versus outcome-based habits.
Hmm.
If it's your identity that you are someone who cares about their body and does what they need to do to take care of it, that's going to be a much different source of intrinsic motivation than saying, I want to look good, because that's an outcome, right?
Right, right. Yeah. If you change that identity
Hmm.
to be, I am someone who values
Yeah,
longevity,
yeah,
fitness,
yeah,
healthy eating, healthy
yeah.
lifestyle, that totally changes.
In coaching terms, you could spin it by saying not attached to the outcome.
Hmm.
And so I can tell you know, candor, even in business meetings, if I go in unattached to the outcome and just look to have a positive conversation with a colleague about X topic, I always get farther than I do if I go into it with some kind of specific outcome based objective. Now, is that always possible? Of course not. There are some more specific conversations that happen, but I think people understand what I'm trying to say. Getting so attached to an outcome, if you are perceiving that it's not going your direction, then what happens? Then we start getting nervous. Then our sympathetic kicks in. Then we slant into this negative space. Then Barbara Fredrickson kicks in, and it's the anti-broaden and build theory. And all of a sudden, we get tunnel visioned, exhausted, and we end up coming out of that situation not accomplishing what we wanted.
Yeah, so let's bring this into land. We've
Hmm.
talked about, the first part, which was the the challenges that we have in
Yeah.
dentistry, the physical challenges, the patient challenges, the emotional challenges. And then we really went into some of the importance of physical activity, flexibility,
Hmm.
maintaining your body, as a temple, kind of a
Yeah.
lot of religions talk about. But really prioritizing your health
Yeah.
for a job that's physically taxing. What final thoughts do you have?
I think it's a journey, not a destination, is what I think. I think that we all would be served by giving ourselves some slack. We've talked about many times grace, not an excuse, and that we as dentists and dental professionals are very much overachievers. And so, if we can sit down and think about, okay, what would be my ideal level of activity this week? What would be a good middle ground? And if I just did this, life would be okay. And so, if we can look at it in those terms, what would be my ideal? What would be a good middle? And you know what? As long as I do this, the world is okay. Then we're going to put a lot less pressure on ourselves to be able to move forward and be consistent throughout our lives.
Yeah, I think what you were saying there made me think back to a few episodes ago when we talked about one is greater than zero.
Yeah.
Don't
Yeah.
think that if you haven't exercised for a few years,
Yeah.
that all of a sudden you're going to be back to your fighting weight that you were in high
Yeah.
school. I mean, this is kind of what happened to me. I've been a high level athlete my whole life. I played AAA
Mhm.
hockey. I was a professional dancer. I was the captain of the water polo team. Like I was a good athlete.
Yeah.
But then into dental school and then into residency and into a few years of practice and got into be maybe 7 years of practice where I look back and I hadn't exercised for 3 years. Like I hadn't
Yeah.
done anything
Yeah.
for three,
Yeah.
4 years. And getting back into it, I was older than I ever was, of course, like you
Yeah.
always are. But
Yeah.
I had to start at something.
Hmm.
And getting there now, I've built my way up to where I'm exercising multiple times a week and I'm doing jujitsu and I'm working on my flexibility and I'm doing other things. I'm eating right. But know that one is greater than zero. Know
Amen.
that, like Martin said, if you have 10 minutes, do 10 minutes.
Yeah.
But know the importance of it and know why you're doing it. And I think
Yeah.
that's probably my final thought.
No, I think that's fantastic. So if people want to come hang out with us, how can they find out more information, Kyle?
Yeah, if you guys want to come hang out with us for 2 days, May 9th and 10th in Irvine, California, 2025, just go to wellnessanddentistry.com, click on links, and I think it's the first link on there is our live 2 day course. It is our favorite days of the year that Martin and I do. We don't do this that often, and so make sure to sign up. bring a friend and coming out with us. It's super, super fun. You get 12 CEs. You're gonna have to get CEs anyways.
Yep.
Why not do it on mastering your mental and relational health and
Yeah.
going deep into all these topics that we talk about on this podcast? So if you're interested in anything that we do, just go to wellnessanddentistry.com. You'll find everything there. Share this with your colleagues, with your friends that may appreciate this. That's all we ask from you. And we'll see you on the next episode.
Take care.